I chose the topic prescription drugs because as teenagers grow older, it is often easier to get prescription drugs compared to illegal street drugs. Teenagers take prescription drugs for a variety of reasons. Some believe that taking prescription drugs will help them have more fun, lose weight, and fit in. Some teenagers think that prescription drugs are safer and less addictive than street drugs, but prescription drugs are only safe for the individual who actually has the prescription. I believe that it is important for teenagers to know the dangers of prescription drugs and how easy it is to get addicted to the prescription drug. Prescription painkillers are powerful drugs that interfere with the nervous system's transmission of the nerve signal we perceive as pain. Most commonly used prescription drugs fall into three categories: opioids, central nervous system depressants, and stimulants. Opioids are used to treat pain or relieve coughs or diarrhea. Opioids attach to opioid receptors in the neutral nervous system, preventing the brain from receiving pain messages. Central nervous system depressants are used to treat anxiety, tension, panic attacks, and sleeping disorders. Central nervous system depressants slow down the brain activity by increasing the activity of a neurotransmitter called GABA. The result is a drowsy or calming effect. Stimulants are used to treat narcolepsy and ADHD. Stimulants increase brain activity, resulting in greater alertness, attention, and energy. Some people experiment with prescription drugs because they think the drug will help them have more fun, lose weight, fit in, or study better. Some teenagers believe that prescription drugs are safer and less addictive than street drugs. Other people try prescription drugs because they believe that they are not doing anything illegal because the drugs are prescribed by doctors. By taking drugs without prescription or sharing a prescription drug with friends is actually breaking the law. Drug users often have trouble at school, at home, with friends, or with the law. Opioids can lead to vomiting, mood changes, decrease in the ability to think, decreased respiratory function, coma, or death. This risk is higher when prescription drugs are taken with other substances such as alcohol and central nervous system depressants. The most common result of prescription drugs is addiction. People can become addicted just as easily as if they were taking street drugs. Oxycontin is the trade name for the drug Oxycontin hydrochloride. Some of the street names given for Oxycontin include Oxy, OC, Killer, and Hillbilly Heroin. Oxycontin can contain between 10 to 160 milligrams of Oxycontin in a time-release tablet. Oxycontin is just as powerful as heroin and affects the nervous system in the same way. Oxycontin is a prescription painkiller and is widely used to treat moderate to severe pain in patients with trauma, lower back disorders, cancer, and following surgery. When used properly, Oxycontin can provide pain relief for up to 12 hours. Oxycontin is prescribed to help patients decrease pain and improve function. 81% of all people addicted to Oxycontin receive the drug from their doctor for legitimate use in treating pain. In 2007, 2.5 million Americans abused prescription drug for the first time, compared to the 2.1 million who used marijuana for the first time. In 2007, the non-medical use of painkillers rose 12%. The demand for referrals to methadone clinics in Toronto has tripled after the prescription painkiller Oxycontin was discontinued. Dr. Rita Shaheen, an associate medical officer of health, states that it is hard to know how much Oxycontin is still out there on the street and whether the demand for services will increase as more people are worried about going into withdrawal. The rate of crimes involving prescription drug is increasing because drugs such as Oxycontin are scarce on the street. The addiction to Oxycontin is estimated to be behind 80% of the crimes committed in the country. People who want to stop using Oxycontin will either replace it with other drugs or go into withdrawal. There are higher risks if a patient discontinues Oxycontin abruptly. People who use Oxycontin in a hazardous way are at a higher risk of severe withdrawal symptoms because they tend to use higher doses. Some of the symptoms that patients have to go through include vomiting, disabling abdominal pain, anxiety, panic attack, insomnia, muscle pain, muscle weakness, and other flu-like symptoms. In conclusion, I chose the topic prescription drugs because it is important for teenagers to know the dangers of prescription drugs and how easy it is to get addicted to prescription drugs. If teenagers are aware of the dangers and consequences of prescription drugs and drugs in general, hopefully they will make the right decisions.